I will be demonstrating how to maneuver through the app in order to properly record nursing notes for a patient along with utilizing the medication administration record electronically. I've already clocked in for my skilled nursing patient, Lori Buford. When I go in to clock in, I will see this tasks button. I will click this and I will begin my shift by receiving report from the previous nurse who was there, and then I will perform my own head-to-toe assessment on my patient. I will then record all of my findings within this tasks list. I can click this menu button in order to go through all of the different sections, and then at the end I will click on nursing notes in order to type out or dictate what I have done so far. Anytime that I either perform an assessment or touch a patient or do any kind of care for the patient, I should be making note of it. So I will begin by typing out my nursing notes. I arrived for my shift at 8 a.m. I received report from the previous nurse. We'll call her Anne. Patient currently resting, performed head to toe assessment. I will then also notate what I found during the assessment, such as heart rate within normal limits, respiratory rate within normal limits, patient denies pain, assisted with turning / position changes. Many of our patients require this, and this should be done every 2 hours. Every time that it is done, it should be notated within the nursing notes. Then, once I am finished with the start of my shift and inputting my nursing notes for that, I will go to the medication administration button, and I can here see the list of medications that my patient has for the 24 hours. I can also scroll down and take a look at the last 24-hour medication administration record for this patient and see that they have already received all of these medications. When I go back to my list, we will say it's 8 a.m. now. I see that they have Briviact due at 8 a.m. So I will click this, and once it's highlighted, I will scroll down and fill in the rest of my med administration record. So this information will already have the date and time that the medication is given along with the status. So if you are giving it, if you are withholding, if the patient refused, or it was a missed dose, you can notate all of that. In this case, we're going to say we gave the medication. The dose should already be in here with the unit as well. And then I will make a note here, as all the nurses should do. Medication administered as scheduled. And we will say patient tolerated well. And then we will save the administration, and that will put it onto our med administration recently given list. So we'll see it at the top here. So the Briviact that was just given. And let's say that we have a PRN medication. So if the patient is complaining of pain or heartburn, it's still 8 a.m. now, we're going to click this so that it's highlighted, scroll down, and it will already give you all the information for the medication. All we have to do is write a note in the caregiver comment, and we will say patient reports pain and heartburn administered as prescribed. And then we will save the administration. That will send it down to the last 24-hour medication list, and we'll see it at the very top. So we'll go back to our list and make sure all of our scheduled meds have been given. And you'll notice that Briviact is due again at 4 p.m. So you'll see that it says Briviact, the time that it's given or the time that it's due, along with the number of the dose. So 2 out of 2 is the one that's due at 4 p.m. Then we will go back to our nursing notes and notice that all of the medications that have been given are in our nursing notes. This will help to provide a better outline of the shift. So we'll go back here and say morning medications administered as scheduled for patient, and we can make a note saying patient tolerated well, will continue to monitor patient's pain level, because remember we gave the medication famotidine and ibuprofen for pain and heartburn, so we want to go back and follow up and make sure that the medication was effective. So we'll say we'll continue to monitor for patient's pain level and heartburn status. So like I said before, any time that a patient is provided with any type of care, it should always go into the nursing notes. So the nursing notes should ideally be many paragraphs at the end of the shift in order to have an outline of everything that was done for the day. So let's say at this point, the patient states that the pain level is not controlled, then we should go into our nursing notes and say patient reports pain level still, and then you want to ask them on a scale of 1 to 10, how bad is the pain level? And if they say it's a 6, we'll say 6 out of a 10, despite medication provided in the morning. And we want to make note of all of this. And then let's say that the patient is having pain in their back and you provided them with an ice pack. You want to notate that as well. So provided patient with an ice pack to assist with back pain reported. Patient states pain resolved. So everything you do for the patient should go right into the nurse notes, and then you'll also want to make a note of that every medication administration will go in here as well. In order to clock out for the shift, which will save all of the notes and all of the medication administration record keeping, you just need to click next, hit clock out, and you have to obtain the signatures. So once this is finished, you will go into signatures, and the recipient signature is the patient's signature, or a family member if they are there to sign. So let's say we take this to the patient or the family member, we ask them to sign at the end of the shift. So they just click here, they will sign as the client, hit the arrow button, and then you as the nurse will click caregiver signature and you will sign as the nurse here. And once this is finished, you need to click next, and you have to click submit for it to actually be submitted to the office.